One of the things that I always, for the last several years, that just strikes me about the Medicare report is that the actuaries do an alternative scenario. And basically, Congress has, I'll let you kind of describe it, but I mean, basically, the actuaries file an alarming report that says, by the way, the numbers that you're reading in this trustees report, we don't think are very representative of what's likely to happen. Why do they feel compelled to do that?
Yeah, this is one of those things that's hard to explain in 10 words or less. I'll try.
Well, I'll give you 12 or 15 words if you.
I'll try, but all right. So under current law, there are some pretty aggressive, ambitious cost savings, basically cuts to provider payments, mostly in Medicare hospital insurance. And there's just a little bit each year. It's like 1% each year, but obviously you cut something 1% each year, it compounds a lot over time, right? And they were enacted as part of the Affordable Care Act. And the program hospital insurance solvency depends to a very large extent on those cuts being upheld, right? If we didn't have those, we hadn't had them to date, Medicare hospital insurance would be going under much earlier. In fact, it might have gone under already. I know that at the time those were enacted, the projection depletion date was 2017. So for all we know, if they hadn't implemented them, the program might already be insolvent. But as many people know, but many people don't, so I'll lay it out, Medicare provider payment rates are much lower than they are in the private insurance side. So Medicare is paying providers about 60% what private insurance pays for inpatient hospital services. They pay about 74% what private insurance pays for physician services. And so we're starting out only paying 60% of what private insurance pays, and we're ratcheting that down, 1% a year. So in a couple of decades, the actuaries say Medicare is only going to be paying 40% of what private insurance pays. And for physicians, and this is actually due to a different law, the MACRA, I won't spell it out, but that's the acronym that passed in 2015. Physician payments are going to be cut even more aggressively over time. So those would be down to something like 27% of private insurance rates. So the actuaries are saying, hold on a second. If we do that, our projections show that we're going to be driving more and more hospitals into negative facility margins, basically putting them in the red. And they're not going to be able to sustain operations. There's going to be enormous pressure on Congress to roll these cuts back. So what they do is they produce this scenario in which from 2028 to 2042, they assume that these payment cuts for hospital insurance and physicians, et cetera, that they are basically phased out and that we stop making them by 2042 or so. And if we do that, the Medicare costs are much, much higher. Now, can I issue a caveat? I know I've been talking for a while, but just issue a caveat on this before I stop. Bob Reischauer and I really wrestled with this because, a lot of people, I think, read the report as saying, ignore the major projections. It's all going to be a lot worse. And these payment cuts in the Affordable Care Act aren't going to work. And everything's going to cost a lot more. And I think we both share the concern about the report being read that way. There's a phenomenon that Mark Goldwine refers to as budget nihilism, which is that, even when lawmakers do the right thing and cut the growth of something, then if a bunch of analysts and experts all come out and say, well, it's just never going to happen, you really destroy the incentives for lawmakers to bite the bullet and to make a tough call. And I think both Bob and I felt like we didn't want to do that. We didn't want to say, oh, you get no credit for this tough vote. We're going to say everything's going to go to hell in a handbasket anyway. So we spent a lot of time, I think, massaging the treatment of the alternative scenario in the report. So what we tried to do instead is to say, this is the amount of savings we are needing to get from these provisions. And if we don't get them, we're going to have to come up with something else that's just as draconian, just as difficult. And so we have a stake in these cost containment mechanisms succeeding. So not to take the tone of ignore what was done, but rather it's important that what was done work. Because if it's not done, if it doesn't work, we've got a much bigger problem.
Yeah, I thought the language over the years has been pretty good on that, and just in saying this shows what we can do. This shows what we can achieve if we can make this work.
Right.